Hi everybody, we're going to talk about integumentary system again, and we're going to work on wound healing and burns. In the course pack, this information comes from page 61. Now, in the previous chapter on histology, we did talk a little bit about wound healing. Specifically, we talked about inflammation and regeneration. Now here with the skin, we're going to break down wound healing into 4 phases. They are the inflammatory phase, a migratory phase, proliferation phase, and the maturation phase. So we should know what happens during inflammation. We know that this is a time when the tissue, such as the skin, may become red, hot, swollen, or painful. So in this particular phase, you can also see that blood moves into the area where there's been damage, perhaps a cut to the skin, and that may eventually form a scab. This migratory phase does show us a scab that has taken place. That's where the blood has coagulated in the area where there's been damage to the skin. We also see some macrophages and fibroblasts migrating into the area. That's because this is the first act in helping us repair this damaged tissue. Macrophages are white blood cells, and they will eat and destroy bacteria, for instance, or they may in fact eat and get rid of dead cells that need to be removed from the area. Fibroblasts, you may recall, help to grow new fibers. What types of fibers are common in the dermis of the skin? Well, that would include elastic fibers, perhaps, and loose areolar connective tissue, or collagen fibers if you're talking about, say, dense irregular connective tissue. During the proliferation phase, we start to see new tissue regrow. We should see this happen within days to a week. And you'll notice in this picture, those fibroblasts are busy building new collagen fibers down there in the dermis of the skin. Over time, that scab will disappear and be gone. Sometimes that particular area will itch around where the scab has fallen off as the skin knits tight and regrows back together. You see in this picture scar tissue left behind, which is composed of many collagen fibers. Now, we hope that over time, that scar tissue can be replaced with normal functioning tissue. The problem with leaving scar tissue in place is the fact that it doesn't have normal function. You know, glands are not here, sensory organs to help us feel vibrations or touch or pressure. Those kinds of things may not regrow back if scar tissue persists. So we hope that the maturation phase will eventually resolve with the elimination of as much scar tissue as we can get rid of. Let's now turn our attention to burns to the skin. We know that if you have a burn, whether it's electrical burns, water burns, or even sunburns, the problems that can arise with a severe burn would be fluid loss from the body part that has been burned. We also lose our protective covering. Over time, microbial infections can set in, and in severe burns, we also can experience protein denaturation and cell death in the area where there's been a severe burn. So when you think about this picture, look at the layers that are burned and count. A first-degree burn is a superficial epidermis burn. A second-degree burn would be either the entirety of the epidermis or down into the dermis of the skin. A third-degree burn burns the third layer. Well, epidermis is first, right? Dermis is second. So if you burn to the subcutaneous fat layer or the hypodermis, now we have a third-degree burn. A fourth-degree burn is 4 levels down. That burns all the way through the epidermis, dermis, hypodermis, or subcutaneous fat, and down into the muscle tissue. And as you can imagine, with the number here, from 1 to 4, we increase in the severity of that burn. We also increase the risk for permanent damage and also for death, because the higher the level, the degree of burn, the more difficult it is the body to repair that particular area. First-degree burns may be something like a bit of inflammation, some redness, some tenderness to that skin. We don't see first-degree burns causing blisters, and that is something you should be aware of. Blisters are not seen with first-degree burns. So we should see redness of the skin, known as erythema, and brief pain. Second-degree burns can travel down into the dermis of the skin. So they're not going to travel the full thickness of the dermis. It may be just the superficial portion of the dermis. However, what we see now are blisters. Blisters are the key thing that differentiates a first-degree burn from a second-degree burn. The problem with blisters is we now can introduce infection down into the dermis of the skin. And unfortunately, there are blood vessels there that can transport that infection to other parts of the body. Here are some pictures of blisters that have come from some form of burn. Keep in mind, what differentiates a first-degree burn from a second-degree burn is blistering. Third-degree burns will travel through the entirety of the epidermis and the entirety of the dermis. Now, these may appear blackened around the edges or reddened, and the person who has a third-degree burn has no pain in that particular area. Why no pain? What have we damaged? Those sensory receptors in the skin pick up on sensations such as touch and pressure, and if we burn through the entirety of the dermis and the epidermis, that person may no longer feel pain in those areas. Now, in this picture, the person may have second-degree burns, maybe in this area here, and that part will be painful because the entirety of the dermis hasn't been burned through. With third-degree burns, skin grafts and IV fluids are needed, so this is certainly a much more severe burn than a second or first-degree burn. Here you can see blackened skin from a third-degree burn. And this awful fourth-degree burn is one that travels all the way through the epidermis, dermis, hypodermis, and into the underlying muscle tissue. So this is an extremely severe burn and may not be able to be resolved with any kind of grafting. So very, very severe burn that we see with the fourth-degree level burn. On your worksheet, you'll notice there is something called the rule of nines. This helps us to estimate the percentage of the body that's been burned. You'll notice that 9 is the common number here. The front of the arm is 4.5%. The back of the arm is 4.5%. Well, that adds up to 9%, right? The front of the trunk is 18%. The back of your trunk is 18%. That's a function of 9. The front of each leg is 9%. The back of each leg, 9%. So technically they've divided the body up into regions here based on the number 9. So if you hear that someone has received burns over 50% of their body, this is the way they've calculated that percentage of burn. To conclude our discussion of skin burns, I did want to introduce you to this concept here, the skin gun concept. There's a really fantastic and short video that you can watch here on YouTube. It's called The Skin Gun, and it's put out by National Geographic. It's a fairly old video, but I did want to mention that in 2018, the FDA approved a skin spray-on technique, just like you see here, that helps use the patient's own skin cells to help regenerate new skin. And if you'll watch that skin gun video, you'll see a man with a pretty severe burn, and you can't even tell where he's been burned. The skin gun allows for a great regrowth of those skin cells. So perhaps this will be the way of the future, and it'll help those with burns to avoid things like scarring and skin grafting.